Hi. Hi, Lori. Well, thank you very much for inviting me here today to speak. I appreciate it. So I'm going to talk about something, maybe you might have heard about. It's called direct primary care. And it's really a healthcare model as an alternative. As you mentioned, a great segue. All of us are sort of struggling with figuring out, healthcare and what our healthcare choices are. And healthcare continues to get to be really expensive, especially for those of us in small practices. And what are our choices? So I'm going to present today what I think is a different healthcare option that you may not have heard of, that kind of falls outside of, your average insurance. So I've been a physician for over 17 years in primary care. I'm board certified in family medicine. I also was an old athlete, so I was certified in sports medicine as well. And I also had the opportunity to do some acupuncture during my training in medical school, and I went to China. And so I got interested as well in holistic medicine. And so, I was practicing medicine for 15 years in a very conventional, setting. And I just kind of felt like, I wasn't able to take care of patients the way I wanted to be able to provide them quality care. So I came here to Jacksonville about 5 years ago to start this type of practice in order to, what I felt like, be able to deliver quality care. Direct primary care, though, is not something that, is unique. When I first started and I looked at this model for practice, there was probably about 600 practices across the country doing this. It was something that the American Academy of Family Practice, sponsored and, gave a lot of talks on. But now it's expanded to over 1,300 practices throughout the country. So it is really caught on quite a bit. It's certainly on the minds of our legislature. There have been several laws that have been passed that have supported direct primary care. One of them is, passing a law that we're not health insurance, so we're not, subject to a lot of the rules and regulations that health insurance typically is. And so what exactly is this direct primary care? How do we define it? It's called membership-based medicine is another term that I often use for it. And it's different from concierge care. I always want to sort of set a little bit of a difference between that, because often concierge care is much more expensive on a monthly basis or yearly basis than what our fees are, and most concierge physicians have a much smaller panel of patients. Most of us direct primary care physicians will on average have 400 to 600 panel of patients in our practice. Sometimes that, will vary by each physician and the services that they deliver. Also, we don't bill any third parties. So again, we try to stay away from insurance as much as possible. There is some exceptions with Medicare, but for the most part, most primary care practices do not bill insurance at all. Now, do we deal with insurance? Absolutely. We have people in our practice who do have insurance, and we have people in our practice who don't have insurance, and I'll talk about that in a little bit later. And we can still prescribe, and we can still refer through a patient's average insurance plan, but we ourselves are not billing directly for any of your visits. So why is direct primary care expanding? Why are physicians looking at this model and deciding that this is something, that they want to leave a traditional system to do? I think that, to me, these are the three main reasons why physicians are looking, and all types of providers are looking at direct primary care. First of all, there's a big emergence in self-pay market. There's a lot of people actually paying cash for their health care. And so there's a demand for price transparency. I mean, if you've ever gotten an order for anything, you don't really know what the price is until the bill actually comes back, most of the time. And so I think that that's led to, people asking and looking for solutions alternatively to that. The other thing, obviously, is quality. A lot of people, right now, a lot of practices, they have to see patients every 10 to 15 minutes. It's a very fast visit, and a lot of patients, when it comes to their health care, feel they need more than that. And then the third thing that we can do is, because of the price transparency, we're able to reduce costs. So I'm going to go over a little bit of those three things and how I think direct primary care delivers those things. So let's talk about health insurance and what most people have right now. For most people, they probably have, if you have health insurance at all, it's a high deductible plan. And so you're essentially paying out of pocket for most of your care that you're getting on a regular basis. If you want a lab, you want an x-ray, you want an MRI, those are, typically low cost, studies and images, and you're usually paying out of pocket for that. And so, according to Gallup, almost 10% of people are uninsured, and if you add that to a poll by the CDC done in 2016, that about 40% of adults now have high deductible plans, that means that about 50% of people out in the healthcare market are now paying cash. And so that's really challenging the old insurance market. A lot of physicians' practices and offices are really designed towards billing insurance. You go to a lot of physicians, and some of them won't even accept a self-pay patient because they just don't have the structures in place to be able to manage that and manage the pricing. So direct primary care really tries to solve that issue by its monthly, membership and sort of making it, a flat fee. The other thing that direct primary care does, again, is that it really is a big focus on quality. What is your average health care experience like when outside of a direct primary care practice? Well, you go into if you want to make an appointment, it probably can't get in the next day. I mean, most of the time it takes a couple weeks to, unfortunately, for some people, a couple of months to actually get in. And then, if there's an urgent issue, you're told to go to urgent care or an ER, and so you're not even seeing your physician. And then once you actually get in to see the physician, you usually have to wait, a half hour. In my old practice, sometimes patients waited 45 minutes to an hour to see the physician. And, it's really difficult in this day and age to be able to carve out that much time in your day. And, then when you see the doctor again or the healthcare provider, it may only be for 15 minutes. You're written a bunch of scripts. You're sent out the door without a lot of explanation about what's going on. So this sort of movement in direct primary care really asks the question, can healthcare be different? Can we have a different model of that? And it also asks the question, should healthcare be different? Should we really look at a different model? So in direct primary care, there's a lot of emphasis on quality. Again, because we have a low patient base, we spend as much time as you need. All of the visits at our office are all a half hour long, and if you want to schedule a visit longer than that, we do that as well. We make sure that we spend to understand the time, take the time to help you understand what's going on and what all your choices are. We're not necessarily beholden to any particular healthcare system. So, sometimes pricing at one location is going to be different than pricing at another location. And sometimes we know that certain providers, are better at delivering certain types of care than others. So we're not really beholden to one particular type of system. And we get to know you well because, again, we have that, smaller patient base. So, that's all great, but the question is, does that really improve quality? Okay, you get to know me better, I have these longer visits, but does that actually improve the quality of my health care? And the answer to that is yes. There are larger group practices, especially out west, that have been collecting data, and the British Medical Journal published a study a few years ago that said that when you're part of a direct primary care practice or a membership-based practice, when you compare that to being a part of a standard practice, there were 66% less specialty visits when you're a part of that, 65% less ER visits, 35% less hospitalizations, and 82% less surgeries. And you can see, in my mind that translates into, quality care and really being able to explain to the patient what's going on and what their choices are, and just being there for someone when they need it. So that's what direct primary care, a membership-based practice, is trying to do. We charge at our practice a flat monthly fee, and in exchange for that fee, we include all the services that we're able to provide for you. And so direct primary care, really is about personalized medicine, providing you convenient care. We offer you, same day or next day visits for any of your urgent needs. For non-urgent needs, we're usually able to get you in within about a week. We provide a lot of visits via telehealth and telephone. Now, I know a lot of people have been doing that with the pandemic, but we've been doing it, all along. So, there was a lot of chronic medical issues that sometimes don't require you coming in. So that saves you, again, time. None of my patients usually wait any longer than 15 minutes in my office. Sometimes, occasionally, it might be a little longer, but for the most part, we get you in, we see you, and have you on your way. And then we do a lot through email. I spend a couple days a week where I am just pretty much looking things up for patients, answering emails, and really having kind of a constant flow in communication. So the idea is that our staff tries to make the healthcare experience, when you do have to go out and get studies or imaging or labs, less of a headache. So that is, what our quality and value statement is for you. And then again, by reducing hospitalizations, by reducing, ER visits, we're reducing cost for you as an individual, and that's, what our goal is. At our practice, we have discounts on labs that we've negotiated for our members. So members get a discount anywhere that they go on labs. On office procedures, any office procedure that I'm able to do is included in that monthly fee. So there's no extra charge for any office procedures. Unlike at a normal self-pay usually scenario, you pay for the visit and you pay for the procedure as well. X-ray, MRI, we keep our finger on the pulse of our partners in Jacksonville and try to find you the best pricing at quality centers around the area for you. So oftentimes we can get X-rays for $35, $40, and we can get MRIs for $400 or so, which, for most people, if you've ever had a facility bill the insurance, they often bill the insurance several $1,000s for those tests. And then as far as pharmacy goes, we do offer the ability to dispense medicines in our office. Now, not controlled substances, but other prescriptions. So we can provide cost savings, although nowadays with a lot of the prescription discount cards and different pharmacies, we just shop around to help you find the best discount for a lot of lab work. So again, those are the savings that we provide, in addition to offering 24/7 care. So if it is, Saturday night and you have a urinary tract infection or you sprained your ankle, you're able to give us a call and me a call, and I'll talk to you about it, and we'll figure out what we need to do. And if I need to see you in the office, I will come in to see you, trying to save you going to an urgent care and save you that money. Now, sometimes you have to go to the emergency room if we think you have appendicitis or something like that on a weekend. But for the most part, we're able to handle a lot of things, refills and things like that, so we save you having to go into any of these other facilities. So again, direct primary care is the idea of affordable flat fee that includes all of these things. So the values and the tenets of direct primary care are to provide quality, to make it convenient for our members, to reduce the middleman, and therefore by reducing costs. And so what we cover, again, this is all of your outpatient or direct primary care needs. For most of us, 80% of what we need is provided by, we can provide by most primary care doctors. We can usually provide most of what patients need. Obviously, for that extra 20%, that's where we begin to look at what other sort of catastrophic coverage that there is and available. And I'll get to that. So again, this is our practice. And who I am, and I'm the name of my practice is called Balanced Physician Care, and we're located here in the Jacksonville area. We're located at the beaches, and we, at our direct primary care office, provide all of these services. Some direct primary cares may not have this extensive services, but just because of my training, this is what we're able to offer. This is our two membership plans. So again, it's all about sort of this primary care membership. So we have a basic care and a premier care plan. The basic care plan is a monthly fee of $69 a month, and it includes, it's really designed for your basic average primary care that you're looking for. We do, at the basic level, charge a $25 visit fee when you do come into the office, but otherwise, again, 24/7 care with the basic membership. We include all your office visits and any procedures that we're able to do. Now, I also am trained, obviously, in holistic medicine as well as hormone replacement therapy. So that's what the Premier Care plan is all about. For people who might be looking for, some more of the holistic or integrative services that we offer as well, or to, maybe have sort of direct care with me. Our basic care, a lot of times we in the past we've had a nurse practitioner that's worked with us or a PA and seen a lot of our basic care patients. With the Premier Care patients, you're primarily working with me alone. There's no visit fees, and we include a set of basic wellness labs with the Premier Care pricing. So for those of you, a CBC, a CMP, a cholesterol panel, and a thyroid panel are all included in our Premier Care once a year. And then when you need labs beyond that, again, we have special self-pay pricing that we have for you for any other labs that you may need. And then because I do acupuncture and acupuncture trained, our Premier Care members have 3 free acupuncture visits when they sign up if they're interested. Some people are not so much. If you decide beyond that you want to continue, we only charge $50 a visit for that. So that's our plans. As you can see, I know this is a busy slide. It may not be easy to see, but this kind of summarizes everything. I'm a primary care doctor that does gynecology, women's wellness visits. We do sports medics and physicals. We kind of do the whole gamut. And obviously I'm sports medicine trained, so I do knee injections and a lot of splinting and, take care of a lot of non-operative orthopedic stuff as well. So that's kind of a list of what we do. We do have family plans because, again, we're family practice, so we have a lot of families who are looking for an alternative, answer for health care as well. And so we have some special pricing for our families. So I've talked a lot about primary care, and again, us being able to, as primary care doctors, take care of a lot of what most people need. But there still is a catastrophic component that a lot of people need. I mean, our membership doesn't cover hospitalizations. It doesn't cover if you need to go to the ER. And those things, do happen. So what we, have presented and we've made people aware of, and some people know a little bit more about it than others, is a health share. So the health shares are beginning to emerge. Now, they're not health insurance, but they are something called a health share, and they do meet the requirements for the ACA, Affordable Care Act, although nowadays that's not, quite as a big a deal. But they do provide catastrophic care. They originally grew out of, a Christian church movement where people would, sort of get together to share each other's costs. But now these have grown into large companies that span several states. We've talked a lot about and talked to our patients about Sedera Health in particular, because they are more secular based, so they don't put any requirements on people who decide to belong to them. And they do span the entire country, so wherever you go, Sedera can cover you. And I'd be happy to answer, a lot of information more on that if people are interested in hearing more about Sedera. We've done webinars, and you can always check out our website when we're doing upcoming webinars talking about a health share. But the reason why I bring it up is that it really does offer a solution. What exactly is a health share? Well, you basically pay a monthly sharing amount. So obviously that's very similar in health insurance as paying, your monthly premium. They call it a monthly sharing amount. And then when you choose your plan, you choose your initial unshared amount that you pick. So that might be $500, $1,000, $5,000. And that determines exactly what your fees are. Now, you may not be able to see this very well, but you can see that based on a sharing amount, that changes what your, monthly sharing is. And then when you have what's different from health insurance is it goes by year. This unshared amount goes by event. So when you have, let's say, a knee strain, you pay out of pocket for everything up to your unshareable amount. You pay that. And then, anything after that, the health share will pay for your bills. And usually if you go to a hospital, what they'll do is they'll negotiate with the hospital on your behalf to bring those bills down because it's in their best interest. If you have a health share, obviously, then they pay less as well. And again, like I said, it goes by event. So once you meet that unshareable amount for a chronic condition, then it's been met for the long term. So now they do have some pre-existing condition stuff, and certainly if you have an interest in them, I always encourage people to call them and talk to someone, and they can give you all the details and all the answers about that. So that's how we sort of couple, these two things together to provide an alternative to health insurance. The reason why we particularly like Sedera is they recognize the value that we provide as a membership. And so if you belong to our type of direct primary care membership, they will give you a discount on your monthly sharing amount when you're already part of our type of practice. Because we go out and we try to find the best prices on x-rays, MRIs, and labs, that ultimately saves them. And so here we have two pieces of this puzzle that fit together as what I consider to be a viable alternative to health insurance. So again, this is our little practice out in Jacksonville Beach. In our group here. So, we provide, these services to all of our patients. And so, please, if this has caught your interest, if you have any questions, let us know. We'd be happy to, we tell all of our people who are interested, we do meet and greets for free, so we can talk about your individual situation and let you know whether it's right for you. So you're welcome to call anytime, and we can talk more about the membership and answer any questions you have and set up a free meet and greet to see if it's right for you. And if you're a small business owner, we do offer business plans for small businesses. Usually that's for businesses that want to sort of have 5 or more members join. We provide discounts on our monthly fees based on that. And Sedera as well, who we work with, also offers discounts for businesses. So, you might look at this for yourself as a solo individual or for a family, but as for a business, this is also an emerging option. We're also part of a larger healthcare network of direct primary care providers throughout the Northeast Florida region. This model is being brought to larger businesses as we begin to network as smaller individual direct primary care offices. So a lot of exciting things going on a regular basis in what we're doing here. So thank you very much for inviting me today. I don't know if anybody has any questions as far as everything I've talked about today.
I have a question.
Go ahead.
Somebody online. Go ahead, Lori.
That's okay, Rick. Go ahead with your question.
I was going to ask you about what you just talked about, the business plan. So we've got people here. I have 3 employees, not 5. So how would something like that work? And so you feel certain pressure to give your employees, a benefit, health insurance, but it's very difficult with insurance. So how would it work with your business plan?
I don't know, Darren, if you want to answer that a little bit more than I do. Darren is our membership coordinator, and he works primarily with our businesses. I'll answer it shortly, and then if there's anything you want to add.
We do have a business page, too. It's the Healthcare for Jacks, and that has the outlines of everything. If you just want to go direct primary care only, or if you'd like to do something with, like, direct primary care plus Sedera, there's an option of that as well. And we, direct primary care option only, we will discount it if you have so many employees too as well. So we have discounts, and they're all available on that website too as well in the outline. I can basically, for any business, I can create your own unique kind of administrator page, so you can take control of everything with the membership. You can add employees, you can subtract employees. I can help you along with that, and you can manage that and pay them the monthly right from in a business account or checking or whatever you need to do. So
we have employers that will have just 1 or 2 employees, and they just pay what the individual price is, $69 a month if they decide they just want to provide, we have people who just want to provide the direct primary care membership. It covers most of what a lot of people need, and they feel that at least they're offering some type of benefit. And then we have people who want to do a combination of both, and that's where Darren gets in to coordinate that. We provide discounts at 5 members or more. So some people, if you have 3 employees, they may have a spouse, they may have a child, they may have an aunt, that they want to bring in as well. And so that's a lot of times we have solo businesses with 1 or 2 employees, but they kind of bring some of their family members in, and they reach that 5-member or more rate for us. And like Darren said, Sedera will work with us to create, again, different pricing structures based on what you're interested in for your group.
I'll jump in here too, if I can, for a second, and just say that, I do that. We don't have 5 people on our business plan. We just pay per person, and that works out just great. So even if you don't have 5 people, it's still a great service, and people, especially staff, really appreciate that. And Dr. Truty's office and Darren. Hi, Darren. has been great in helping us keep that going and get that set up. So, so
Well,
go ahead.
Well, it's up there. What is it? I see 69 and then I see a 49 and I can't see it from here. What are those numbers? On the right.
It's per child.
Oh, okay.
It's all the child. This is tough to get all that info.
Yeah, so the $69 a month is for an adult, and it's $49 a month for if you add on a child. So we charge less for anyone 18 and under.
Okay.
And the Premier, the same thing. Yeah.
Yeah, and I'll jump in here too and just kind of give you guys some perspective. I think the direct primary care model is amazing. I first learned about it from Dr. Truty, gosh, when we met, like what, 5 years ago or something. And my family has been members of her practice for almost 3 years now. We do the direct primary care and the Sedera together, and have had fantastic experience with both. I think, I like Dr. Truty's practice very, very much. And I think there's other practices that do the direct primary care and might do it a little bit differently than she does it. And, kind of looking at which practice kind of suits you best. But I think the direct primary care model is just amazing. I'll give you if I can, Dr. Truty, kind of brag on you for just a second. So my youngest has allergies and asthma, and was it last week or was it week before? I think it was week before. Yeah. I picked her up from practice. It's 5:30. She can't breathe. She's having a massive, massive asthma attack, and she can't speak. So I immediately called Dr. Truty's office and talked to them. And, one of the options, of course, was to go to the emergency room. And if I didn't have Dr. Truty's office, I would have had to have taken her to the emergency room. Instead, I took her to Dr. Truty's office and she was able to see her, figure out what was going on, treat her, and we were able to go home with no emergency room visit at all. So that is phenomenal. And she was able to see her. She already knew her. She knew her history. She knew her background. She knew everything about her. So that just gives me a lot of comfort to know that, number one, it was 5:30 after hours. She stayed late for me to get to her office, and I was able to see her right then and there. So it's been amazing. I can't tell you how many times I've sent her an email like at Saturday night, and then I get this response. I'm like, "What are you doing? It's a Saturday night. Are you not with your family?" Like I didn't expect such a quick response. So it's just been really, really good. There's been times where I've had an ear infection, and I don't even have to go in. We just talk about it on the phone or do a video call, and various things with children, that kind of come up. So it's just been an amazing experience for us. I think Dr. Truty and her staff have a lot to do with that. And I think it's also been direct primary care model has been just phenomenal. So that's why we started offering it as a benefit to our employees. And I think, and especially in this market right now, being able to offer things to your employees is really important. And healthcare is ridiculously expensive in that regard. So this to me was a great alternative. And I know we're going to have, people watching the video and things like that maybe aren't here. So if there's any questions, to reach out to their office, and they're very, very good about answering them.
Thank you, Lori. I appreciate that. And that's exactly what we try to deliver. Now, I'm a solo practitioner, so, certainly there are times where I'm away and on vacation. I have coverage arranged for me for that. I have another physician that will sometimes see patients in the office and then is available again to come in. And sometimes in Lori's situation, I knew her daughter really well, and that's the whole point in knowing something. I knew where she was at, and I knew I could bring her in, and I knew that I probably could take care of her. But it could have been a different scenario. Lori could have given me a different description of what was going on with her daughter, and I might have said, you have to go to the ER. I really can't fix that. But because I knew her really well, I was able to make that decision, and that's sort of a great example of what we're trying to do. So, yeah. Thank you, Lori.
Thank you for coming and telling everybody about this. I think more of us need to know that this is available, for sure.
I know you have a question.
I was just curious, would having this kind of direct plan, like, qualify for the requirements under the Affordable Care Act, or do you have to get this plan and the DARA plan in order to satisfy what's required of it?
Yes, unfortunately, you have to get the Sedera plan and this plan because our membership plan does not offer that, catastrophic coverage. It doesn't qualify. So that's why we put the two pieces together. And I appreciate that, Lori. Whether this is something that you've looked at now for yourself or your employees, but if not, I ask, please file it away. You never know when it comes up in conversation. It's balancedphysiciancare.com. Darren does a great job with our social media trying to, so I'm sure if you Google direct primary care, Jacksonville Beach will pop up too. Because there's a lot of people out there who are just like, they're struggling and they just haven't heard about this. And because we're not large institutions, you don't see a lot of, TV advertisements during the Super Bowl and stuff like that about what we do. So my practice has been built primarily on word of mouth, people having a good experience and then, telling that to families and members and friends. So thank you again for giving me the opportunity to come here to pass the word along and let people know that there are other options out there. So again, whether it's our practice or another direct primary care practice, I'm an advocate for the model in general.
And Dr. Truty, you've reminded me about the acupuncture. I think it's time for my next acupuncture visit.
I've made believers on a lot of people in doing acupuncture. So, all right, thank you. I don't know if there's anything else that you guys need to do with the meeting.
Thank you, Dr. Truty.
Thank you very much, Lori, for inviting me.
Okay, so as far as the rest of the meeting goes, well, I guess we're done. I do know that next month I've scheduled with my accountant to talk about accounting, but I also know that they've moved the filing deadline to May, so I'll have to check with him because he may get bumped to June because he will not come during tax season. I can tell you that. So look for that. There'll be an announcement. Obviously, we give you a heads up on that kind of stuff. And Lori, do you have anything?
No, I just thank you, Craig and staff, for getting the hybrid meeting set up. We appreciate that. And we'll see you guys next month.